Assalamu alaikum. I am Kasim Jiskani on the platform of Virtual Academy for Nurses Job Preparation. And today's subject is ACN-III Advanced Concept in Nursing, Community Health Nursing, in post RN third semester and BS Generic semester. So we will solve the MCQs, BCQs from 105 to 125. Let's start. Question number 105. Habitat which an infectious agent normally lives, grows, and multiplies includes human, animal, and environment. That habitat is called reservoir host or reservoir habitat. Next question. The community nurse has been asked to investigate a sudden outbreak of symptom among restaurant patrons. This nurse will be acting as the who communicate uh, and investigate sudden outbreak, that is known as educator nurse. Question number 107. Which attribute allows the community health nurse to influence the action of the local city commission leaders in taking an acting role regarding the health of their community? The role is called leadership. Option A is the correct option. 108. Home visits are important for the providing dash identification of community health structure. Option D is the correct option. 109. Which level of health facility is usual point of entry of a client into the health care delivery system? That facility is known as primary health facility. Option A is the correct option. Which of the following is the primary goal of community health nursing? The primary goal of a community health nursing is to promote health and prevent diseases in communities. Option B is the correct option. Which of the following community health nursing module focuses on the exploring communities to take control of their health? Empowerment model. Option C is the correct option. What is the role of community health nurse in health community? The role of community health nurses promote health and prevent disease, as we have discussed in previous MCQs. Option B is the correct option. Which of the following epidemiological measures in used to describe the frequency of a disease in a population? That is prevalence. Option A is the correct option. What is the primary goal of primary prevention in community health nursing? To prevent diseases. Option B is the correct option. Which of following vacancies in accommodated for all adults to prevent influenza? Vaccines which prevent influenza is influenza vaccine. Option C is the correct option. Which of the following community health nursing interaction is most effective in promoting health in communities? The health promotion. Option C is the correct option. What is the role of community health nurse in conducting a community health assessment? To identify health problems in community. Option A is the correct option. Which of following community health nurse setting is most effective in providing health care services to vulnerable population? Community health center. Option C is the correct option. Which of following health promoting strategies is most effective in promoting physical activity in community? That is the environmental changes. Option C is the correct option. What is the primary goal of health promotion in community health nursing? The primary role of health promotion in community health nursing is to promote health. Option C is the B is the correct option. Which of following disease prevention strategies is most effective in the preventing infectious diseases? Option A is the correct option, vaccination. What was the primary purpose of the Millennium Development Goal? To reduce poverty and hunger. Option A is the correct option. How many MDGs were established by the United Nations in 200? There are 8 MDGs. What are the MDGs? Millennium Development Goal. Millennium Development Goal MDGs. They were set for the 2020, 2000 to 2015. What are the 8 Millennium Development Goals? Number 1, eradication extreme poverty and hunger. भूख और गुर्बत को खत्म करना. दूसरा, अचीव यूनिवर्सल प्राइमरी एजुकेशन. प्राइमरी एजुकेशन सबके लिए. तीसरा, promote gender equality and empowerment women. जेंडर इक्वलिटी और बराबरी के हुकूक. चौथा, reduce child mortality. बच्चों की मौत की शरह को कम करना. पांचवा, improve maternal health. प्रेग्नेंट वुमेन, औरतों की सेहत. नंबर 6, combat HIV, AIDS, मलेरिया एंड अदर डिजीज. जो कम्युनिकेबल डिजीजेस हैं, वायरल, HIV, मलेरिया एंड अदर. सातवां, इंश्योर एनवायरमेंटल सस्टेनेबिलिटी. माहौलियाती जो है वो बेहतर माहौल और माहौलियाती जो है कंटामिनेशन उसको रिड्यूस करना. आठवां, डेवलप अ ग्लोबल पार्टनरशिप फॉर डेवलपमेंट. दुनिया से बाहमी ताल्लुक जिससे तरक्की के रास्ते खुले. ये 8 मिलेनियम डेवलपमेंट गोल थे और उसके 21 टारगेट्स थे, 60 इंडिकेटर्स थे. अगर इनमें से कोई भी क्वेश्चन आए तो आप सॉल्व कर सकते हैं. क्वेश्चन नंबर 124, व्हाट वाज द टारगेट फॉर reducing extreme poverty by 2015 as outlined in MDG 1. तो सबसे पहला जो MDG मिलेनियम डेवलपमेंट गोल था वो था पॉवर्टी को कम करना और हंगर को जो है वो रिड्यूस करना. तो हाउस द प्रोपोर्शन ऑफ पीपल लिविंग इन एक्सट्रीम पॉवर्टी. वो किस लिए? जो लोग बहुत शदीद गुर्बत और भूख में रहते हैं. What was the target for reducing child mortality by 2015 as the outline in MG? जो चौथा गोल था उसमें था कि 5 साल के बच्चों की मौत की शरह जो है वो कम करना. This was the 6th lecture and 20 MCQs. We will come back with 20 more MCQs in next lecture. Allah Hafiz.